Hi, Grandma. Happy Thanksgiving. This week we learned about inflammation in my immunology class, and so I'm going to tell you a little bit about it. First, it's important to recognize the signs and symptoms as we go through the process, then you'll be able to recognize something that you may already know about inflammation. So first, there is redness, pain, heat, swelling, and loss of function. So keep that in mind when I talk about the steps through inflammation. First, a foreign pathogen has to invade our body, and that triggers a response. So when our body recognizes that there's a foreign substance within our system, it becomes alert and needs to try and get rid of it. So macrophages are present within our bloodstream, and so they migrate to the site of infection and release vasoactive substances and cytokines. Cytokines are really important. They are substances that are released that signal different cascades and bring other substances to the site of infection in order to clear it. Cytokines can cause vasodilation, which is the expansion of our blood vessels, and this causes redness because the blood is expanding to the area, and heat because everything is migrating towards that specific site. Also, cytokines can cause pain, which is another sign of inflammation, so that's important to recognize. The vasodilation can be caused by a factor called tumor necrosis factor alpha, otherwise TNF-alpha. And this increases the vascular permeability and promotes migration of other immune cells to come to the site of infection. This is important because we need our fighter cells to get to the site of infection in order to clear it. So with the increased vascular permeability, this causes swelling, which is another hallmark of inflammation, because a lot of fluid is coming there, and so that causes edema. And then there's pain because the buildup of pressure can be painful. Then at the site of the infection, there are chemoattractants, which are released, and they cause a gradient, which allows neutrophils and other innate immune cells to come in and start the process of phagocytosis to remove the foreign molecules. In order to kill the molecules, though, this can be done through oxidative or non-oxidative killing, so with or without oxygen. And there are different cells that are a part of that, and so killing the microbe is the way to clear the infection. And once the microbe is cleared, then these immune cells can destroy themselves, and the body can start to return to homeostasis. If the inflammation is persistent, though, and not stopped by the immune cells, then we need to bring in our adaptive immune response, which is kind of like our secondary fighter system, and these take a little bit longer to make, and those include our T and B cells, as well as activated macrophages, and these directly attack the persistent pathogens, and so that's a way to clear the foreign molecules without, if the innate immune system doesn't work. So inflammation is obviously beneficial because it promotes the activation of our immune response to come and kill it off, but it does have some drawbacks. A lot of times fever is associated with it, or pus, and so those can be very harmful to our body if they get into our bloodstream. The pus and then the fever can do damage to our other organs. So that was just a basic overview of inflammation, and I hope you learned a little bit about it, Grandma. So happy Thanksgiving, and yeah, we learned a lot.